Hello, and welcome to the very first episode of Vital Voices, the show where we dive deep into the health and wellness initiatives that are transforming lives in the Bahamas. I'm your host, Alexis Burrows, and I'm thrilled to embark on this journey with you as we spotlight the people, organizations, and stories making a difference in our community. In this premiere episode, we're kicking things off with an inspiring conversation about breast cancer awareness and early detection. Today, I'm joined by Dr. Deveaux, Chief Medical Officer at Oak Tree Medical Center, who is here to tell us about the Million Mammogram Movement 242, an initiative aimed at saving lives through free access to 3D mammograms year-round. We'll discuss the motivation behind this $1 million in-kind donation, the importance of early detection, and how women in the Bahamas can access these life-saving screenings. So grab your headphones, get comfortable, and join us for this important conversation. Let's dive in. First and foremost, welcome to the show.
Nice to be here.
So obviously we are kicking things off. This is an entirely new era of, talking about health and wellness and things in the medical space here in the country. And we are excited to have you, Dr. Deveaux, as our first guest. For those of you who don't know, Dr. Dawn Deveaux is the Chief Medical Officer at Oak Tree Medical Center. You guys have been in operation, I think, for about 7 or 8 years now.
7 years.
Mm-hmm. And through that time, the health network has grown from, I think it was 1 facility to begin with, and I think now you have 7 brands, so to speak, within that facility, 5 physical locations, if I'm not mistaken.
Yes, 5 physical locations, but like I say, 7 or so brands of various entities.
Yeah, and offering primary care, specialist care, imaging, labs, diagnostics, the whole 9.
Urgent care, pharmacy.
Mm-hmm.
Yep.
All right. So basically full service in the clinical, outpatient clinic type of space. And I think you also have a surgical suite as well.
That's correct.
Okay. So a very broad scope of services offered by the Oak Tree Medical Health Network. So, obviously today we are here to talk about the Million Mammogram movement. This is something that has been quite a page turner in the medical community and in the local community. I'm not sure how many people were ready to see something like this, but can you tell us, starting from the bare bones, starting from scratch, what inspired the launch of this specific movement, the Million Mammogram movement?
First of all, thank you very much for housing me here. The movement in and of itself, I just take back to what we stand for at Oak Tree Medical Center.
Mm-hmm.
I tell people we're caring, compassionate, and complete.
Mm-hmm.
And one of the key things for us, Oak Tree literally represents a ministry. This is a Christ-based ministry. And for us, our job is to give hope. And so here in the Bahamas, when I looked at the last stats, anywhere from 300 to 500 women are diagnosed with breast cancer annually. And the most alarming thing about those stats is at least 48% is diagnosed less than the age of 50.
Yeah.
And so those are some very startling stats. And just for comparatively speaking, the average age of diagnosis here in this country is, they say, roughly 42, whereas in the US, it is 62. So you're telling me the Lord promised us 70. And so we are losing people very prematurely for just bare basic stuff.
Yeah, I know. I always find it interesting, being on social media, obviously people tend to walk through and display their journeys very publicly. And I'm always alarmed by the amount of young women that are posting about their walkthrough with breast cancer. And I'm talking about you're talking about 30, 35-year-olds. Obviously, when you look at that average of 42, that means you do have some people in the 60s group, but that means you have a lot of people in that 30s and early 40s group as well. And I'm always alarmed because it just seems like we have such a, like the statistics show, such an alarming rate of women developing breast cancer at a very early age. And so it does speak to the importance then of an initiative like this in getting the screening done early. So there's a lot of different ways that people approach giving back to the community, doing things like this in terms of, discounted services, things like that. Why was it important for you to take the approach of a $1 million in-kind donation for free mammograms?
Yeah. So just to go back to your initial question, like what was one of the reasons that truly inspired me? So my grandmother, who literally sort of took care of me, who I learned how to bake from, cook from, and everything else in between. She was diagnosed at the age of 69. Actually, no, she was diagnosed early, but she died at 69. So she she left prematurely from breast cancer. And then actively, I have an aunt who literally, she's now completing her treatment, with chemo radiation at this time. And so it is something very near and dear to me. And so it was something that was always in my heart to do. And it was just timing. And so when you have great, what I would say, to whom much is given, much is required. And so my grandmother, when she was sick, she always would tell me I would be a benefactor for so many people beyond my wildest imagination. And this is just one of those things, thinking back 20 plus years ago, when I'm laying in the bed next to her, taking care of her, to see these things happen years down the line, it just gives me goosebumps in reality. And then, so from my standpoint, earlier this year, that's just September, I was inspired by the Holy Spirit. I just got up one morning and said, hey, this is what we're going to do. Mapped it out. But for me, I tell people time and time again, the earth is the Lord and the fullness thereof. And so for me, I am just a steward of the blessings He's sort of bestowed me with. These are not mine. These are not my resources. These are His. And so I just wanted to give that benefit to the Bahamian patients at large. And so for me, I would still, in this particular podcast, give Him all the glory, because a year to this date, I was at a situation where my whole radiology department was in shambles, and like only God. And so last year I was in shambles. Now this year I am in the land of the harvest. And so instead of keeping those blessings to myself, I decided to pass the blessings on to the patients, and try to impact our community.
That's an amazing thing. You know, I sit here, the conversation around breast cancer always gets a little bit touchy for me. Not in a negative way, but just because, you know, I went through the experience of my mom being diagnosed and, you know, passing away within basically 18 months or so of the diagnosis. So this is always a very, you know, emotional conversation for me, because, you know, obviously my mom was a little bit later in life, but at the same time, you still look at it, you know, she didn't necessarily get her 3 score and 10. And so you look at things like this and you're like, you know, there's an opportunity to really help people to get access to, you know, this early detection space. You mentioned earlier, and the statistics show it, you know, nearly half of the breast cancer cases in our country are, you know, diagnosed in women under 50. What is, you know, what comes into play in that? Why is that the case? I know, you know, you have people talk about the BRCA gene and things like that, but what is the reasoning behind, or from your vantage point as a physician, why it seems that we have so many of our younger women being diagnosed with it?
No, like you stated earlier, so there's a significant genetic component in all of this. It is said, and I don't know why, that we have the highest incident of BRCA1 gene in the world. And so that's not a good thing. And my thing is, if we know this information, why aren't we as aggressive with the screening? We don't know why, but we know mammograms are the #1 screening tools for breast cancer. And so to me, this should be a national priority. And so one of the reasons why we started it in September in particular, because what happens is you have a peak in interest in October, and then it just weans off for the rest of the year. Breast cancer doesn't do that.
No.
It's peaking January to December, Monday through Sunday. And so it does not take a break. And so the reason why we're doing this particular initiative is sustainability is the key.
Mm-hmm.
We have the resources to be used, and so I rather it being used for the good rather than sitting up catching dust, worrying about, hey, did we meet the margins? My question is, did mom come home tonight?
Yeah.
Because that's who's affecting. It's affecting mothers, daughters, sisters, family, friends, and everybody else in between. And so when we lose such a vital part of the community, it shows. Yeah. And hence, this is why it's just so important.
Oh, yeah. You know, and that's why I say for me, it's a personal conversation because I look at it, you know, we hadn't had my son yet when my mom died. And so we live knowing that, you know, he never got an opportunity to meet her. She never got an opportunity to see him while on earth.
Yeah. And she didn't get the chance to give him the matriarchal blessing.
Right. And that's the thing, you know, when you think about it, that is what makes things like this so important. Because like you said, it's mothers, it's sisters, it's daughters, it's wives, it's family members, friends, loved ones. It is that it permeates through the nation that deeply and that widely. So obviously, you know, you mentioned mammo is the gold standard for screening for breast cancer. How specifically does early detection through that process impact survival rates for women? Especially given that, you know, going through your press release and some of the information that was covered in it, one of the things that you mentioned is that a lot of the cases are discovered at later stages. So, you know, how does early detection play into the overall potential of survival?
So when you're in stage 1 and stage 2, your 5-year survival is like greater than 90%. Whereas the latter stages, 3 and stage 4, especially particularly stage 4, stage 4 means you have metastasis, as in it's spread already throughout the body. And so at that point, when you're in stage 4, you essentially have a death sentence. It's just a matter of when. And like we've seen some miraculous things happen. But generally speaking, your chance of survival goes down dramatically at the lower stages. And so I had just met, I think her name was Miss Larson, Susan Larson, with the Ride for Hope Foundation. And what they're doing in collaboration with the Cancer Society through going to the various family islands. I think that's very important because at least here in Nassau, we have, in Providence, we have other diagnostic centers who can provide that service. Our brothers and our sisters in the various family islands, they don't have that advantage. And so that particular program, I think, is very important. And so throughout this initiative, what we're seeing is, I didn't know a lot of these groups existed actually. And so to see the various support groups for breast cancer in particular, it was actually overwhelming and very impressive.
Yeah.
And so if we can do anything to help those particular causes by providing the free services, we are all in.
Yeah. And I think it's really it is really interesting to see because every year or so you see that there's another group, another set of people who are joining the fray of trying to assist, whether it's through support groups, whether it's through providing assistance from a financial perspective in terms of, you know, getting like obviously Sister does the porta-cats, things like that. And you see people kind of stepping into that fray more and more every year. So I know you guys did some work with MD Cares, who is also kind of bringing a different flavor to that support group space and interesting ways to try and navigate that process.
Yeah.
I want to go back though a little bit to the conversation about your grandmother, because, you know, you mentioned that this is kind of your connection to it.
Yeah.
And I think you and I have had conversations offline about what that was like for you, because you mentioned that you helped to take care of her as someone that you spent a lot of time with. You know, how did her journey with it shape your passion for this initiative?
For me, it was, I just said, hey, you know what? If we can prevent this for other people, why not? And like I say, at that particular point in time, during that phase of my journey, I was nowhere in the space nor advancement to do such a thing. But here we are, almost 25 plus years later. The Lord has been gracious for me, gracious to me. And so here I am. Like I say, whom much is given, much is required. And so this takes nothing off me to do such an impactful initiative. I tell people money is important, but it isn't everything. And so this initiative is going to impact the community in such a positive way. And back to the name Million Mammogram movement. We said $1 million in time when in actuality it's gonna far surpass that. Because from our standpoint, unless something untoward's happened, the thought process is this is an indefinite program. This is a multi-year program. And so we are not going to see how you have March Madness. We're not going to see the October frenzy anymore.
Okay, fair enough. And like you said, it's not something where you can only find it in October, or it only pops up in October. So it's good to have someone in the space that's offering it year round. One of the things you mentioned as kind of your approach to this: caring, compassionate, complete. And I think that compassion comes into my next question. There are a lot of barriers that people sometimes face when accessing healthcare in general. But what barriers do you think that women typically face when trying to access mammograms, and how does this initiative help to address those challenges?
Honestly, one of the key things is actually awareness. You would be surprised that, hey, she's 50, she should know these things. When in actuality, that's not the case. I've actually seen a few cases where we've had women seen by other physicians, and the mammogram question wasn't even brought up. And to me, that's actually startling.
Wow.
And so I'm a nephrologist by training, but I'm a physician by profession. And so if I'm seeing, say, for example, someone with kidney-related disease, one of the key things I still ask from what they call healthcare maintenance standpoint. Okay, she's 40. She needs this done. He's 40. He needs this done. And so this is a part of medical training. And I think we just need to highlight the importance of primary care, because this should not be the case. I should not be finding a 50-year-old woman hearing about mammograms for the very first time.
I think it's interesting. I think it goes back to your point about to whom much is given, much is required. Because I think sometimes so like I know for me, I learned about the BRCA gene 2 or 3 career stops ago. I was working at a local insurance company, and they had actually brought in someone from the US who was doing research on the BRCA gene, and they did a whole presentation. And so for me, that's something where I came into the knowledge of that information just from being in marketing in that space. And so now I think about it, I'm like, yeah, but I was right there in the moment. That doesn't necessarily mean that information is readily accessible or that that's known broadly throughout the space. And I think that's why conversations like these are helpful in trying to make sure that we bring about further awareness to the need for screening, when you should start, those sorts of nuts and bolts things, but also giving people an opportunity to actually access it. Because accessing healthcare, has become a little bit difficult over the last few years. One thing that I've noticed, though, from being in the healthcare space, being in the marketing space, I can say that this particular cause brings everyone together. You have a lot of different groups that exist, but it's not this territorial in the approach to it. It seems like everyone is like, no, we all need to fight this together. And so you have people from, different spheres, different interests, different roles and responsibilities, but you tend to find a lot of those groups working together. So I know for you with this initiative, you have partnerships with a number of different organizations, both on the support side and then on the insurance side of it with the initiative with CG Atlantic, things like that. So how Did those partnerships come about with Cancer Society, with Sister Sister? You mentioned Ride for Hope, CG Atlantic, and how do those partnerships help to maximize the reach of what you're doing?
So when we essentially launched it, the initial thought process is, say, for example, the Cancer Society, the Sister to Sister. Say, for example, these are like known entities fighting this battle for years. And so I just saw it fit from a partnership standpoint. These would be the first persons I'm reaching out to because they have the framework in place. They just needed the resources. And so here we are with the resources. Here they are there with the administrative component and the wherewithal. And so to me, it just made sense.
Yeah. Sometimes it's just that. It just makes sense. It's as simple as that. You mentioned that the intent for this is, I'm not going to put words in your mouth. You said indefinite. I'm going to use the word in perpetuity. But how do you ensure year-round access to these free screenings beyond the focus in October? Because we all know, like I said, I've worked between healthcare and insurance for a large chunk of my career. And so everybody knows what October is. And everybody knows that there's this crush to the point where you have, extensions of discount programs and things like that. But from this perspective, what else are you doing to ensure that this access continues, to use my word, in perpetuity?
So this is all about, once again, marketing, working with the right personnel. And so those two who I mentioned already, Cancer Society, Sister Sister, also the Family Island Initiative, because that's something that's been going on for years, and it doesn't stop in October.
Right.
And so now all of these places, and I think we had just spoken recently that her name is the Quested Dean. They also have a foundation as well. So that's someone who we're going to probably be working with as well.
Okay.
And so when we vet the persons, we be like, why not? And so one of the key things too is here at Oaktree Medical Center, we are definitely concerned about the community, but we're also concerned about our internal community, i.e. our staff members, our colleagues. And so what we've done, anyone over the age of 40, they are entitled to get a free mammogram. They don't need any vouchers or anything. And so we're also taking it a step further. We have more than 200 plus staff. That includes part-time and full-time. And so each staff member, whether they're part-time or full-time, they also get a voucher to give to their loved one of their choice.
Oh, that's amazing. It's funny. I'm out into a very new and different space personally, career-wise, and I find that there are a number of interesting people like yourself, like some of the other people that we've been talking to, my wife and I, about going and assisting in different ways. And I always find that, the experience you have with a business, whether it's healthcare, whether it's restaurant, whether it's retail, whatever it is, you can always tell when the employees are treated well because you tend to have very little negative interactions with them. And so you kind of see, the importance that's placed on not just giving back to everyone that's out there, but also giving back to your own. And I think that's a really unique and cool part of the initiative that you guys have put forth. Now, going back, like I said, I kind of read through the press release, and heard about Audrey Seymour, heard her story of survival. How has success stories like that also influenced the work that you're doing at Oaktree?
It's everything. It's almost akin to say, when the Lord, one soul is saved, everyone rejoices. And so if one life is saved from premature death, we all rejoice. And so we take pride and great joy when someone is saved. And so we catch them at a particular time. And not to veer off the topic briefly, it's like the same thing with colon cancer. Like we've increased the awareness dramatically with it. And it's just an amazing thing to actually see.
Yeah. It really is. I imagine there are a ton of women out there with stories that may be similar to Audrey's. How do you encourage, or what would you say to encourage other women to share their experiences in order to assist in raising the awareness and motivate others to prioritize their health? Like I said, I know a couple of people mid-30s that have shared their journey. You know, they posted when I'm not familiar. I think you ring the bell at the end of the treatments, and I've seen people posting that. So, you know, what would you say to encourage women who've gone through the battle, who've come out on the other side, who survived, to encourage them to share their experiences?
It's why they call it a testimony or a testimonial, because they have been battle tested, because it is mind, body, spirit, and to go through that experience, you have to give God the honor, glory, and praise, because it's not, nothing is guaranteed. And so when you make it out edified, you testify. And so it encourages people, because we have to make people, let them know, hey, you're not alone in this fight. You are with the community. We empathize with you. We are here for you. And like I say, be careful, little mouth, what you say, because that same mouth can bring you up or take you down. And so we have to speak positively. We have to speak life. And so for us, this is why everyone who goes through this, they should shout a joy. They should shout praises. They shouldn't let the whole world know, because it's just encouraging to somebody in a dark corner thinking they cannot make it to the light. But when you're showing them the light, it makes a huge difference. And we are called to be the salt and the light of this world. And when you go through these things, it makes a big difference.
It's funny, my wife and I have been having a lot of conversations recently about suffering. You know, like I mentioned, the past 3-4 years of my life have been very interesting. We went through a very turbulent time with my wife's health. Obviously, like I said, my mom got diagnosed with cancer in May of 2020. She passed away in December of 2021. My dad passed away in May of 2022. And it just felt like there was just so much suffering that our family was going through. And now, as we've come out on the other side of it, like I said, you know, not long after all of that happened, we found out that she was pregnant with our son. And you see that blessing on the other side of the storm and on the other side of the dark times. And you realize, you know, sometimes your suffering is for others to see. Right? Because you may be strong enough to walk through that, or you may have a support network that's strong enough to carry you through that, but someone else may not. And so you talking about getting through your suffering and getting through to the other side allows other people to say, you know what, like you said, I can do it. There's someone just like me who's gone through this experience, and there they are at the end of the journey, standing as a survivor, and I can make it to that point as well.
And for me, like just back on that, the isolation, it's the tool of the enemy. It makes you feel as, hey, you're not worthy. Why is God doing this to you? And puts you in that state of severe depression when that is not of God. So that's one of the next things.
Yeah, the isolation is definitely a part of it. I think that was a part of the difficulty for my mom going through the journey, because that was when all the lockdowns happened. You know, you couldn't do this, you couldn't do that. And a lot of the support groups even went from being in person to being virtual. And that made it a very trying and challenging process to go through. You know, you talk about this idea of, you know, it's called the Million Mammogram Movement. You anticipate that inevitably it's going to cost more than that, or it's going to be more than that it ends up being. From your vantage point, and this may or may not be a difficult question to answer, but how many free mammograms are you aiming to offer through this movement? And what has the response been like from the community thus far?
So the response, first and foremost, has been robust. And it was actually very encouraging, because, like I say, we went from doing maybe 5 mammograms a day to now like 25. And from a marketing standpoint, it's definitely worth it, because a lot of people up to now still didn't know we had all of these locations. And so when they come at the location, they say, oh, we didn't know you had some all this stuff. And so from a marketing standpoint, it has been fabulous. But more importantly, from a patient care standpoint and community impact, through the charts.
Yeah.
And to answer your question, how much? I would just say, our God is someone, he knows no bounds. And I would just leave it like that.
I love that answer. So just getting into some nuts and bolts stuff, because like you said, some people may not know the different facilities where everything is being offered. So, you know, which of your locations are offering the screenings? Where can people go to get the mammograms done? And how can women gain access to the vouchers?
Okay, so we have 2 locations where the M 242 mammograms can be done. It's at our East Street South location in the Independence Plaza. That's where I think Subway and Dunkin' Donuts is there. And that's actually our largest facility. It's a 10,000 square foot facility.
You wouldn't know it looking from the outside.
Definitely not. And then the next location is our Prince Charles location. I think it's number 310 Prince Charles. At the red light by Seabreeze. Continue to go east. On the left-hand side, it's like maybe 1,500 feet east of the red light.
Yeah.
If you pass that corner, you went too far.
It's a good reference point. As Tusac is sitting down having this conversation.
And then in terms of how do we access them? Like I say, 2 of our major players is Sister and Breast Cancer. And Cancer Society of the Bahamas. Like I say, we have others. And I think I told you about the Mr. Quesadine. She has a support group. We're gonna look into that a bit further. Then our NHI beneficiaries here at Oak Tree Medical Center, they would have access to it. And then we're looking into further NHI expansion, where if they were to do NHI beneficiaries, if they were to do, and we'll probably start this in January, so if they were to do their annual labs at Oak Tree Medical Center at any of those locations, they would also be bundled in with the free mammogram. And so it's a symbiotic relationship, and that's what we aim to strive for.
So from you mentioned your NHI beneficiaries. I know you guys also have the Oak Tree Primary Plus Plan, OPP.
Yes.
So where does the mammogram, this movement, sit with your OPP members as well?
Yeah, so Oak Tree Primary Plus, it was an initiative. Like I said, it got up 3 a.m., wrote the program down, inspired by the Holy Spirit, but it's a program designed to help people, especially for those who don't have any health insurance. And so mammogram, like prior to the Million Mammogram Movement 242, Oak Tree Primary Plus, which we started in June of this year, mammograms, free mammograms were in that primary care. And so it's offered in the Primary Care Plus plan.
Okay, so it's built in already.
It's built in already.
Okay, fair enough. I think you may have answered this to some degree, but I'll ask in case there's anything else that you have in your mind. How do you plan to sustain this initiative beyond the initial launch, and what are your long-term goals for this program?
So, for me, sustainability is key. So, one of the things we had noticed in October, like I said, the October frenzy, we had already given out all of the mammogram vouchers, and people were saying, "We want more," and this is what we want to avoid,
right?
And so we had to put out something publicly to say, "Hey," because funny enough, someone was saying, "Oh, this is a scam. They're scamming people." I'm like, "Okay, we're helping people," and so. What we do is we give a certain amount of vouchers to all of our various partners. And once the voucher is out, then they have to wait till the next month. And then the following month. And then the following month. So it's akin to when we're printing money, you have to be able to service that. So if I print vouchers and I'm not able to service it, that's where devaluation comes into play.
Because It makes sense. So if your capacity, and I'm going to throw out a number because I'm not doing the math, but I'll just throw out a number for reference. If your capacity is 10,000 mammograms per month, you can't print 20,000 vouchers and have 20,000 vouchers in circulation, because then you don't have if everyone actually accesses a voucher and it comes in, you're not able to actually offer the service because you don't have the capacity to service 20,000 mammograms.
That's correct.
Yeah. Okay.
And then on top of that, I actually still have a business to run.
Right.
And so we want to be community centered, but I have to make sure my electricity bill is paid. I have to make sure my water bill is paid. I have to make sure the machine is maintained. And so those stuff require money. And so I have to make sure we do it in a way where it does not affect the standard business,
right?
Because it's the standard business allowing us to run this program
in the first place, right? And that's why, like you said, sustainability is key.
Yeah,
building it out in a way where you're able to maintain this, not necessarily to say you gave out your 1 million mammos in just October 2024, but the idea that you're doing this and you're allowing it to extend for a long time.
Yeah, because this should be millions,
right?
Mammograms.
Yeah, because I'm like, are we going to be sitting here in 5 years talking about the millions of people that have been able to get?
And truth be told, I know it's going to surpass it, but I'm not looking at the money. I'm looking at the lives being impacted.
Yeah. Like I said, I think you and I have both seen and been impacted by people who've gone through that journey, and I think it hits in that same way, which is, if we, by having more screening options available and making it more accessible, we're able to save even, 1 life, 2 lives, it's worth it, because that's somebody who has, more time to spend with their loved ones, with their spouses, with their kids, with their grandkids. And that's critical, because it's all we have sometimes.
Exactly. And the key thing about the screening, we don't just offer screenings. In the case of Mrs. Seymour, she is someone where she had the initial screening for the mammogram, then she had an ultrasound, then she required an MRI, then she required a biopsy, then she required her breast to be removed with a mastectomy. So then she required a port placement. And so the amazing thing about all of this was done within the Oak Tree Medical Center Health Network. So from screening to mastectomies, to port placements, to MRI, all of it was done in the outpatient center.
Yeah, that's the thing. Because obviously, if you find something, then there's the sequelae of additional screening, treatment, all of that comes into play.
And so this brings my completeness component to what we do. So only when she was able to get a port placement, we had sent her over to the public health system, and she was able to access treatment there. And so essentially this is a partnership with the government in reality. We are saving lives.
But that's why I said, I think, there's definitely room and opportunity for more engagements like this between the private sector and the public sector when it comes to, especially to areas like healthcare, because we should want our people to live as long and as full lives as they can. And so being able to make that access to care easier is critically important. And that's a part of the reason for even having a show like this in the first place, is to be able to have these conversations and kind of push that forward, right?
Yeah.
I think you've touched on this, but giving you an opportunity to kind of speak to it a little bit more clearly, as a health network that is focused on holistic, patient-centered care, how does this initiative align with Oak Tree's broader mission and values?
So for me, like I say, caring, compassionate, complete. And so for me, this is, like I say, a ministry. And you're going to always hear me say community, country, and Christ. And so it's all in alignment. And we're here to serve. We want to be the difference maker. And we want to be the change we want to see. Sounds cliche, but action speaks louder than words.
Yeah. And obviously with this movement, the action is there. So for our listeners who may want to support or learn more about the Million Mammogram movement, where can they go to find information? Are there any specific phone numbers they should call? Obviously, we know you mentioned the 2 locations if they have a voucher or if they are on OPP, if they are in your NHI program, they can go to one of those two centers at, I think you mentioned East Street South in the Independence Plaza and then on Prince Charles. But where else can they get information about this initiative?
So we are in a transition, a great transition at Oak Tree Medical Center, where we're going to be more visible. We have consulted a robust marketing firm, archipelago marketing firm to be exact. And we are launching some real marketing tools. And so we're going to be starting our Facebook page. We're updating our website at www.oaktreemedicalcenter.com. And then for a specific number, you can call 1-816-4-OPP.
Okay.
Or that's 1-816-4677.
Okay. All right. This has been a great conversation. It's amazing to kind of hear you talk through your decision-making journey, what influenced you to step out and do something like this, the partnerships that you've created along the way. And like I said, I do hope that, we can revisit this conversation 3, 4, 5, 10 years down the line and see just the sheer amount of people that this initiative has been able to help over the years.
And as a deacon at Evangelist Temple, let's live his love. Thank you.
Well said. And that wraps up the first episode of Vital Voices. I want to give a heartfelt thank you to Dr. Deveaux and Oak Tree Medical Center for sharing his mission and insights with us. The Million Mammogram Movement 242 is truly a game changer in our healthcare landscape. And I hope this conversation encourages you or someone you know to take that crucial step towards early detection. If you want to learn more about MMM242 or find out how to access the free mammogram screenings, head over to www.oaktreemedicalcenter.com, and don't forget, your health cannot wait. Thank you so much for tuning into our premiere episode. If you enjoyed this conversation, be sure to subscribe, leave us a review, and share this episode with your friends and family, especially the women in your life. We'll be back next week with more vital voices and transformative stories. Until then, take care, stay healthy, and remember, every voice matters.